the most important thing are the people of UAE and the UAE governors that helped me in this journey. I owe them, and whatever I have been here in UAE is because of the people, because of the support of the people and patients, and availability of all facilities in this country. The most important thing is to work hard, to study hard, and to want what you call the best of everything for your patient. We call it in Arabic khair. You want khair for the patients, more khair will come to you. The challenges was hard working, you know, I was dedicated to my job. I sacrificed my time for my family, for my pleasures in my life, and all my life has been focused first in orthopedic surgery.
Hello everyone, and welcome to our show Bells of Union, where we meet incredible pioneers from different sectors here in the UAE. I'm thrilled to meet today one of the brightest minds in the medical sector, especially in the orthopedic surgery. Please welcome Dr. فريد قاسم زاده. How are you, doctor?
Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam. We are excited to have you here today.
Thank you very much, and it's all pleasure for me that I have you came to see me today, and I have the pleasure to talk with your.
Thank you so much. It's our pleasure as well to talk to one of the successful doctors in the UAE like you, doctor. Thank you so much. First, let's start talking about your successful journey in the medical field and starting talking about your educational background, most important certificates you have obtained, as well as the professional experience.
I got my national board certificate in orthopedic surgery in 2001 from Tehran University in Iran. So I'm originally Iranian. I've been practicing in UAE since 2002. 1 year after I was graduated, I left the university and I started my job initially at Iranian hospital. So I've been practicing in UAE since 2002. My fellowship in osteosynthesis and arthroplasty is in 2006 from Calgary, Canada. And my field of job in the past 24 years has been mostly focused on knee replacement surgery and arthroscopic sports injuries. I've also experienced in various fields of orthopedic surgery, but most of my experience in knee replacement and recently added to my practice is robotic assisted knee replacement surgery.
So doctor, talking about your field, orthopedic surgery, what are some common injuries or conditions you have treated or you are treating right now?
Most of the sports injuries, because the UAE has a young population in two sectors.
True.
Some of them, the old population, that they will come for knee replacement and for reconstructive surgeries. And the other group is very more than the older people, is the younger generation, that they are very active in sports and they come with various types of sports injury in their knee joint and in the shoulder joint. I can tell you that UAE is one of the most common places in the world that they faces ACL reconstruction. The ACL tear, Rabat Salibi, call it Rabat Salibi Amami, is one of the most common injuries in the young population in UAE. And among also the older people, senior citizens of UAE and people who live here for longer, because of the lifestyle, we don't know with genetic background, why not, the rate of knee joint osteoarthritis is very, very common.
Yeah.
This is among my practice.
Exactly. Doctor, you have mentioned about the robotic replacement.
Yeah.
So we want to talk more about the latest advancement surgical technology that have improved the patient overall
I will
experience.
tell you what is a very simple examination.
Yes.
For example, our job is mostly around knee joint. This is a normal knee joint. You can see the surface, the cartilages are very shiny and very mobile. But when the arthritis happens in the knee joint, we will have cartilage damage, roughening of the surfaces, crepitation in the joint, difficulty in movement, pain in every movement, difficulty sitting on the floor, and the patient cries in every moment of the pain when the arthritis gets severe. It can affect the distal part of the femur, proximal tibia, and backside of the patella. So, traditionally what we were doing, we were opening the knee joint, we cutting the dirt, the damaged surfaces, like a dentist job. We clean the damaged part of the cartilage, and we replace it with a cover, which is takes the shape of the host bone, and it makes a very smooth surface on the bone. This is like this. And for the proximal tibia, we put another implant with a polyethylene, so they makes a very nice gliding movement. This is the traditional knee replacement.
Yes.
And the final result will be something like this. So you can see that the knee joint moves smoothly without pain. So the arthritis, the bone is your own bone, knee joint is your own knee joint. You only do resurfacing the cartilage damage. What we do with robotic surgery is that it helps us like a calculator. You can be a very good mathematician. You can have a count of list of numbers, can calculate the sum of them with your mind. But you can use always a calculator to do it accurately.
Exactly.
Robotic surgery will give us like the calculator. So we will see what we are doing exactly, like real time. We can calculate everything prior to do any cut. So it makes the operation very, very accurate with minimal ligament injury. Slightly the time of surgery is increased, but that's not an issue because the results are much more better than doing a traditional knee replacement.
Exactly.
Yeah.
Dr. Farid, I know that every successful journey must filled with some challenges along the way. So if you could share with us some challenges you have faced, and what are the strategies you have followed to overcome such challenges like this?
The challenges was hard working. I was dedicated to my job. I sacrificed my time for my family, for my pleasures in my life, and all my life has been focused first in orthopedic surgery. So I'm born as an orthopedic surgeon, I can tell you easily. So it's my life. It's a part of my life. So I love my patients, I love my job, and my family has helped me a lot to let me do this.
Or completing that journey. Talking about family and maybe other close friends or relatives, I know that surrounding yourself with positive people is always important in order to maintain this successful path. So if I ask you, Dr. Farid, about your supporters, who have supported and encouraged you to maintain your successful journey?
My most important supporters are my patients. The positive feedback from my patients, my motto is that I will ask the best of everything for my patients. This best of everything is not always surgery. Sometimes not doing a surgery is the best thing that I want for a patient. And this bilateral relationship and asking khair, you call it khair for your patient, this will bring you high. And this is the things that will, the best joy of my life, to ask the best of thing for my patients.
Being a trustworthy doctor.
So my patients have been my best supporters.
Exactly. Doctor, we are here today in King's College Hospital in Dubai. Yes, if I would ask you about other services and other departments here in the hospital other than orthopedic surgery.
I've joined this hospital since the beginning of that. This is a new hospital. And I can tell you that this is one of the best hospitals that I have been working, because we have a different departments. We have a hand surgery unit with the best hand surgeon and hand physiotherapist. We have foot and ankle surgery. We have a sports surgery. We have a spine surgery. And we have a different unit for arthroplasty. So we are covering A to Z in orthopedics and rehabilitation. This is a very comprehensive orthopedic department. And recently we have the pleasure of having a center of excellence in orthopedic surgery, which is a very, very, very important credential for our hospital. And I've been the first master surgeon who has been practicing at King's College Hospital.
So Dr. Farid, you have mentioned about the robotic replacement and some latest advancement in the surgery field. If we want to talk more about the artificial intelligence and technology in the medical field in general, so in your opinion, can technology or artificial intelligence replace the doctors in the future?
It can be with a great help for the doctors in the future. Definitely it is the future of medicine, but it can never replace the doctors, because the most important thing for healing of the patient is patient relationship with the doctor. So emotion is a part of our job. We are not machines. We are human. The patients are humans. We need to feel our patients. We need to feel their pains. This is something that still has not been incorporated in the artificial intelligence.
Yes.
It will be a great help for decision making. It will be great help for calculation. It will be great help for the surgeon, for the patient to have more information. And you know, the information is the most important thing for a successful plan of management.
Though artificial intelligence is the future of medical field, but never a replacement. Exactly.
It's a great help.
Dr. Farid, you are a role model in your field and in the medical sector as well. What are some advices you would like to share to the young people who are watching us today?
The most important thing is to work hard, to study hard, and to want what you call the best of everything for your patients. You call it in Arabic khair. You want khair for the patients, more khair will come to you, and the patients will be more happy.
Exactly. Thank you, doctor. We are here in the UAE as well, and UAE has contributed to your journey, creating your journey and your career as well in the medical field. So what message you would like, appreciation message you would like to convey to UAE?
Thank you very much for asking me. The most important thing are the people of UAE and the UAE governors that helped me in this journey. I owe them, and whatever I have been here in UAE is because of the people, because of the support of the people and patients, and availability of all facilities in this country. So thank you very much.
Thank you, Dr. Farid Qasem Zada. It was blessed to talk to you today.
The pleasure is all mine. Thank you very much.
Thank you so much. Dear audience, this is the last of our episode. Thank you for watching. See you next week. Goodbye.